Hello everyone, welcome to sqadia.com. I'm Hina Khan, and today the topic of our lecture is immersion deaths. Now, drowning can be defined to deaths referred as after submersion, death which has encountered within 24 hours. And it basically also, we are going to discuss the near drowning syndromes during this lecture. Now, in this lecture, basically, in the first section, we'll be discussing the signs and estimation of duration. The immersion deaths, how do we basically define the immersion deaths, and what are the consequences for these immersion deaths? It's very important. What will be the complications related to these immersion deaths, and how can we basically differentiate between ante-mortem and post-mortem drowning if it is possible at that time. Now, the signs of immersion is another thing that we're going to discuss in the first section. Moving on, we'll be discussing the estimation of duration for the immersion. Now, the time since death is the basic part as the forensic practitioner. And so we usually come across all of these time since death calculations, may it be the immersion deaths or not, or any other sort of deaths. Now, in the second section, we'll be discussing the deaths from the natural cause. Even sometimes, apparently, the death is considered as due to drowning, but the underlying cause can be something which is more natural. Now, before entering into the water, sometimes the death has occurred. So it's basically the post-mortem drowning. It is regarded as the post-mortem drowning. This phenomena is known as that. And then we'll be discussing the death while in water. So the death while in water due to some traumatic injuries other than the normal pathological mechanism which is encountered by a person who is drowning. Then we'll be discussing the injuries sustained before entering or while in water. It can be the freshwater drowning or it can be the saltwater drowning as well. Then in the third section, we'll be discussing the deaths other than drowning. Now, deaths from immersion other than drowning, the phenomena of drowning in which it is not the predominant phenomena, and it basically some other kind of trauma or some underlying pathology which was already pre-existing in that person. That will be discussed in this section, and the mechanism for all of these other types of drowning and death in bathtubs. Now, death in bathtubs is sometimes very commonly encountered, and the medico-legal aspects which are important for this, it can be homicidal kind of a death, even it can be accidental deaths in the bathtubs, and then suicidal kind of deaths are not very common, which are not very commonly encountered in bathtubs. Then in the fourth section, we'll be discussing the deaths from drowning and the underlying mechanism which are specific for the asphyxial deaths encountered through the drowning mechanism. Then we'll be discussing the autopsy signs for drowning. What are the peculiar autopsy signs for drowning which we'll be looking for, and how can we basically differentiate the ante-mortem drowning from the post-mortem drowning phenomena. Then in the fifth section, we'll be discussing the chemical and the histological changes for the drowning phenomena. The chemical changes which are underlying this syndrome, we'll be discussing that in detail, and then we'll be discussing the histological changes at a tissue level, what changes we can observe, and basically a lot of different tissues can be placed for this discussion. For example, the lung tissues, the stomach, the intestines, all of these can be discussed in detail over here. And then we'll be discussing the diagnosis and the diatom test also. Diatom test is basically signifying whether it was the ante-mortem sort of drowning or it was the post-mortem sort of drowning. So it is a very crucial differentiating test, and we'll be discussing that in the fifth and the last section. So I hope you want to learn more about immersion deaths. So do watch the other sections for this lecture as well. Thank you for watching sqadia.com.